Hello, I'm Eleanor and I am the Participation and Involvement Facilitator for Paris Mental Health Alliance. I'm sorry I couldn't be there today, but I wanted to give you an update on some of the work that I've been doing over the last year. First of all, our longest running project is Powys Patients Council. This is a voluntary organisation which is committed to giving a voice to Powys residents where they're offered acute mental health services. We hold regular patient-only meetings where they can give their feedback on their experiences on the ward and the services they receive. We then pass this feedback on anonymously to staff so that we can find solutions. I currently coordinate Patients Council in Bronclis. Patients Council at Shelton Hospital has been coordinated by Sue, one of the trustees at the Alliance. The future of the Patients Council in the North is a bit uncertain at the moment due to uncertainty over Powys beds, but Powys Mental Health Alliance will continue to support Shelton patients in whatever way we can. Since the last AGM, we've seen lots of developments in Patients Council in the South. We've held a couple of review meetings where we've looked at what's going well and what needed improvement. As a result, we've updated our publicity, we've updated the operational guidelines, and we've introduced feedback forms so that patients can feedback their views on services if they can't make our Patients Council meetings, or just if they prefer to feedback in that way. We also identified that ongoing training is important, so we've had training from Kirsty Morgan, Independent Mental Health Advocate for South Powys. This was really helpful in improving our understanding about advocacy and has helped us advise patients on this service. I hope to organise some more training in the new year. The feedback system needed improvement to ensure that patients' views are really heard by senior staff and to give adequate time to work together to find solutions. As a result, in addition to our initial feedback conversation on the ward, we also meet quarterly with representatives from planning and performance, facilities management and the ward managers to discuss possible solutions. This has been a really constructive group and has ensured that patients' views are heard by senior staff. Their feedback really does make a difference and we've seen some really positive changes as a result. A couple of examples. Patients often complain that they didn't have access to newspapers or magazines on the ward. Through the Stronger in Partnership network, we've secured some funding through charitable funds and purchased a subscription to some newspapers and magazines, and this will really help combat some of the isolation felt on the ward. There was also a lot of feedback that there were not enough vegetarian choices without cheese. We passed this on to George Pigden, the hospital facilities manager, and he ordered a stock of non-cheese dishes. The choice of vegetarians has now increased and patients are really pleased that the message had got through and made a change. There is still work to do here. For example, I'm currently working with the ward to develop a resource centre where patients can find out about their medication, its side effects, and a variety of other areas of interest such as advocacy, benefits and services in Powys. There are also ongoing issues on the ward, such as lack of internet access and a restriction on mobile phones. We're continuing to work with the ward on these, but we're really pleased in particular that there's now an agreement in principle to have internet access on the ward once the practicalities are sorted. Over the last year, we've had some new volunteers and said goodbye to old ones. I'd like to say a really big thank you to all of the Patients Council volunteers because the project really wouldn't work without them. We've got some certificates to give out today which we hope go a small way to show our appreciation. In terms of the future of the PPC, I'm working to develop a community model where patients who have been discharged from hospital or who are currently registered with CMHTs can feedback about their experience of hospitals. Hopefully we can use this experience to positively influence decisions and to contribute to the improvement of mental health services in Powys. There has been a lot of interest in this from different people and we're currently part of a portfolio bid that Pmha are putting into the big lottery as part of a community voice fund. We really hope that we'll access this funding in the next year so we can get moving on this project. It's my role as an employee of the Alliance to support the work of the Stronger in Partnership network. The Stronger in Partnership network is a group of organisations and individuals who share a commitment to improving the participation of people with experience of mental distress in the design, planning, delivery and evaluation of mental health services. My role is to support individuals who wish to participate in this way. I've worked with people in a number of ways, from helping them access the training they're interested in, to helping them write about topics they feel strongly about, some of which are featured in our magazine. One individual has been inspired by a recent conference he went to, and has lots of exciting ideas for the future about alternatives to hospital and alternatives to medication. I'll do whatever I can through the network to support these ideas. Stronger in Partnership has really gained momentum over the last year, and there's been some great opportunities for networking. We're now working on developing a stronger and more clear identity so that people can easily understand what we're about. I'm hoping to develop some publicity materials that will support this. My work at the Alliance Trustees has involved being part of their working group where we've been working towards developing the future of the Alliance. We've worked hard to update our visions and objectives, which you can read about today. We really feel like they reflect what the Alliance is about. We recently held an open day which was really well attended and a good opportunity for meeting new people as well as seeing old faces. We asked people what they'd like to see the Alliance doing more of. A lot of people said they would like more awareness days where everyone could get together and learn about the things that affect them in Powys. As a result, I'm hoping to organise an inform day in the new year where we can get together to learn about welfare reform, benefits and supporting people to employment, etc. Personal independence payment is something which has been worrying a lot of people who we've met through Paris Mental Health Alliance. We'll also aim to have representatives from the Citizens Advice Bureau and the NHS so that we can learn more about these things. People also told us they'd like us to be doing more arts and crafts activities, so we're hoping to organise an arts and crafts day with complementary therapies in spring next year. At the open day, everyone was given the opportunity to express their wishes for Powys and to tell us what they felt our priorities for the next year should be. Amongst our aims and objectives, people felt that the most important ones were to support the participation of people with lived experience in the design, planning, delivery and evaluation of mental health services. They also felt it was important to raise public awareness of aspects surrounding mental health and well-being and aiming to reduce stigma and discrimination. We'll continue to work with a working group over the next year to try and tackle these. This year's AGM marks another new start in the future of the Alliance as we welcome a new set of trustees. I hope to continue to work with them, especially in the working group, so that we can develop the future of the Alliance. As part of this, I'm hoping to build on the publicity we've already done by making some promotional videos. If anyone is interested in helping out with this, please just get in touch with me. I'm also really looking forward to working with the new development officer to contribute to the future of the Alliance. If you have any questions about this or want to get involved in any way, just get in touch with me. But for now, I hope you have a lovely day and Merry Christmas.